Hello everyone, assalamu alaikum. আজকে আমি কথা বলবো আলনা নিয়ে. This is the ulna of right side. The anatomical position of the ulna is the olecranon process is directed upwards. The trochlear notch and coronoid process is directed anteriorly, and the styloid process is directed downwards and lies posterior-medially. Okay, this is the anatomical position of the ulna. Now, presenting parts. Ulnar presenting parts. This is the upper end, intervening shaft, and lower end. Okay, প্রথমে আসি upper end. Upper end এর কিছু presenting part আছে, সেগুলো হচ্ছে olecranon process, then coronoid process, and এটা হচ্ছে radial notch, trochlear notch, then এই যে radial notch এর posterior border এই বরাবর যে রিচ দেখা যাচ্ছে একে বলা হয়েছে supinator crest, and এই যে coronoid processের সামনে যে একটা রাফ জায়গা দেখা যাচ্ছে এটাকে বলা হচ্ছে ulnar tuberosity. Okay, now trochlear notch gives articulation with the trochlea of the humerus and form humero-ulnar joint, which is hinge type of synovial joint, and this is a radial notch articulates with the radial head and form superior radio-ulnar joint, which is pivot type of synovial joint. Okay, superior surface of the olecranon process, it has anterior smooth part and posterior rough part. This posterior rough part gives insertion of triceps brachii. Okay, now lateral surface of the olecranon process. Lateral surface of the olecranon process gives insertion of the anconeus muscle. Okay, now medial surface of the olecranon process. Medial surface of the olecranon process, at the upper part, it gives origin of flexor carpi ulnaris, and at the lower part, it gives origin flexor digitorum profundus. Okay, and this is coronoid process. Medial border of the coronoid process, it gives origin at the upper part, flexor digitorum superficialis, and at the lower part, pronator teres. This is ulnar head of the pronator teres muscle. Okay, below the coronoid process there is a rough part, is called ulnar tuberosity. Ulnar tuberosity gives insertion of brachialis muscle. Okay, and there is supinator crest. Supinator crest gives origin of the supinator muscle. Okay, now upper end is complete. চলে আসি lower end. The lower end is rounded, and this is the actual head of the ulna, and the head of the ulna is articulate with the ulnar notch of the radius and form inferior radio-ulnar joint. The head is separated by an articular disc from the carpal bones. Okay, so ulnar head, এটা wrist joint from corona, and this is the styling process of the ulna, and it is directed downwards and lies posterior-medially. Okay, and the posterior surface of the lower end, it bears a groove that contains the tendon of extensor carpi ulnaris. Okay, good. Now upper end and lower end শেষ হয়ে গেল, এখন হচ্ছে shaft. চলে আসি শ্যাফটে তিনটা বর্ডার আছে, একটা হচ্ছে anterior border, then posterior border and interosseous border. Okay, interosseous border is sharp, and interosseous border gives attachment of interosseous membrane. Okay, and এই যে ulnar tuberosity, এই ulnar tuberosity-র lower part-এ এইখানে অ্যাটাচমেন্ট থাকে হচ্ছে oblique cord, যেটার আরেকটা প্রান্ত অ্যাটাচমেন্ট থাকে হচ্ছে radial tuberosity-র lower part-এ. Okay, this is the interosseous border, this is the anterior border, and this is the posterior border. Okay, and surface, it has anterior surface, posterior surface, and medial surface. Okay, now muscle attachment of the ulnar shaft. Okay, medial surface, anterior border and anterior surface gives origin flexor digitorum profundus at the upper 3/4 of the shaft, and at the anterior surface at the 1/4 of the shaft gives origin of pronator quadratus muscle. Okay, অর্থাৎ ফ্লেক্সর ডিস্টারম প্রফান্ডাস এই মাসলটা এই অংশ জুড়ে অর্থাৎ মিডিয়াল সারফেস এবং অ্যান্টেরিয়র সারফেস উইথ অ্যান্টেরিয়র বর্ডার এই সম্পূর্ণ অংশ জুড়ে এতখানি অরিজিন সে নেবে, অ্যান্ড শুধুমাত্র অ্যান্টেরিয়র সারফেসে লোয়ার 1/4 অফ দ্য শ্যাফট এইখান থেকে অরিজিন নেবে হচ্ছে প্রোনেটর কোয়াড্রেটাস। ওকে, নাও তাহলে অ্যান্টেরিয়র সারফেস অ্যান্ড মিডিয়াল সারফেস টোটালি কাভার হয়ে গেল দুইটা মাসলের মাধ্যমে। অ্যান্ড নাও posterior surface. Posterior surface, it is divided by a vertical line. Posterior surface, it is divided by a vertical line, and at this line there is attachment of aponeurosis of flexor carpi ulnaris. Okay, and the lateral part of the posterior surface, lateral small part of the posterior surface, there is origin at the upper part abductor pollicis longus, and at the middle extensor pollicis longus, and at the lower part extensor indicis, and those are origin. At the upper part there is insertion of the anconeus muscle. So this is muscle attachment and presenting parts of ulna. Now ossification. Okay, ulna ossifies from one primary center and two secondary center. One primary center for the shaft, which appears at the 8th week of intrauterine life. One secondary center for the upper part of the oligoclonal process, which appears at the 10 years, and it fuses with the shaft at the 16th year. Okay, and the lower end, it ossifies from one secondary center, and which appears at the 5th year, and which fuses with the shaft at the 18th year. So the lower end of the ulna, it is the growing end of the ulna. Okay, this is all about ulna. So দেখা হচ্ছে অন্য কোনো বক্স নিয়ে, ততক্ষণ ভালো থাকবে। আল্লাহ হাফেজ।